Hello and welcome to today's Medical World News, where we provide you with the latest news across a variety of healthcare specialties and a number of interviews with experts in the medical field, many of which are focused on the ongoing COVID-19 pandemic. I'm your host today, Gina Columbus. Today, we'll get updates from Pharmacy Times, OncLive, Cure, Infection Control Today, Psychiatric Times, Contemporary OBGYN, and the American Journal of Managed Care. There's so much to discuss today, so let's kick things off with Pharmacy Times. Over to you.
Hi, I'm Alana Hippensteel from Pharmacy Times. Before we get started, one of our top articles today discusses how the Department of Health and Human Services has authorized state licensed pharmacists to order and administer COVID-19 vaccinations once they're available to patients aged 3 years and older. There's more of that on pharmacytimes.com. Today I'm speaking with Brian Nightengale, president of Good Neighbor Pharmacy, on the value of diversifying a pharmacy's business through meaningful health and wellness services. Why is it important for pharmacies to diversify their business through meaningful health and wellness services?
Well, it's a requirement, I think, to stay alive in the future. As I just mentioned, I mean, the act of dispensing medications, unfortunately, has become much more commoditized, right? And as that has happened, the reimbursement for those services, those dispensing services, has really diminished over the years. And for the independents who aren't quite as diversified and have the huge front ends and the other revenue streams beyond the prescription medications to balance out their business portfolio, it really is essential that they leverage that local uniqueness that they have within their communities, the ability to provide that differentiated care and those services, and that they leverage that in a manner that does bring in different revenue streams and ability to expand beyond that dispense mechanism. Of course, we need regulatory changes and changes in reimbursement models for that to happen, and we're continuing to advocate for that. But even beyond that, I mean, for example, we just launched for our Good Neighbor Pharmacy members a Pet Meds program, where now our pharmacists can provide prescription veterinary medications for the extended family members within their customer base. So that's just one example. There's other areas, serving hospices, certainly providing enhanced clinical services beyond that dispense are all critical. And the independent pharmacists are uniquely positioned to do that because they're not filling 1,500 prescriptions a day. They have the time and energy and resources and certainly the expertise to do that. Yeah. So I think that is a critical need for those pharmacies that haven't already done so to continue to evolve their businesses and their practices to meet those unique needs within the communities that they serve.
Yeah, yeah. So the HHS recently authorized pharmacists to order and administer a COVID-19 vaccine upon its availability. How does that authorization affect Good Neighbor Pharmacy's operations and services in the near future?
Yeah, I mean, it's a great thing, and we've advocated and we've worked with HHS and CDC and state authorities and others. Certainly that's a regulatory barrier that needed to be relaxed in order to enable pharmacies to do this. Many of our pharmacy members are already CLIA waived. They're already able to do a lot of these things. So it won't be that big of a stretch for them to expand into COVID vaccinations. I think the biggest issue is going to be just the logistics around those vaccines. They're going to be very, at least for what we see now, they're going to be very labor intensive in terms of temperature control, timing, appointment based, documentation, those type of things. So there will be workflow challenges that we will help them work through. But the first key is to be able to have access to those vaccinations, to be able to get the patient scheduled and get them in, and then all that documentation there. So they're perfectly capable, they're ready, and they're willing. It's just a matter of, figuring out the uniqueness that's going to be required by the various COVID vaccines and making sure that those pharmacies are equipped to be able to handle again, like I said, the temperature control requirements and those type of things. But they're ready, willing, and able, and it's just a matter of coordination and access at this point.
Right, right. How is Good Neighbor Pharmacy preparing for this upcoming flu season in which both influenza and COVID-19 will be in circulation?
Yeah, I think it ties into what I just said a little bit. I mean, we at AmerisourceBergen are in constant communications with the authorities, CDC, HHS, and the manufacturers in terms of planning and preparation. So that's number one, is being aware of the current environment, being aware of what's coming, and being able to be prepared for a very quick response once something is available. It's not going to be normal.
Yeah.
And quite frankly, I think the fact that the potential for a COVID vaccine coming on top of flu season, in a way complicates things, but also in a way can help things because the pharmacies are ramping up for flu season anyway. So, but again, I think it's just making sure there's open and frequent communications and frequent planning. And again, that there's a recognition that while we go through our normal processes every year to prepare for flu season, that there's parallel path that's going to intersect at some point with COVID, and just making sure that they're ready. So again, we host every other week, we're hosting customer town halls and teleconferences, giving them the latest information that we know at the time and sending out a lot of communication and such. So I think it's just continuing to be diligent and communicating effectively as frequently as possible.
Okay. Yeah, absolutely. What is the value of a pharmacist in the delivery of meaningful health and wellness services in the pharmacy?
Yeah, I'm hoping that again, one of the few positives that comes out of COVID is that there's a broader recognition that value has always been there, right? That local access to care. And if you look at kind of the current statistics right now, I mean, there is a growing concern around a shortage of primary care physicians in this country, and particularly in underserved communities. It's hard to get access to a primary care visit. Sometimes it takes too long. And a lot of those services can be provided at their local pharmacies. Not all, of course, but many. And if you think about it, again, other statistics, 95% of Americans live within 5 miles of a community pharmacy. They're open all the time. Individuals see their pharmacist and go to their pharmacy many, many more times. I think it's 6 to 8 times more frequently than they do their physicians. So pharmacists are highly educated, they're highly accessible, and they're available to provide that appropriate care and to communicate and connect with the primary care and other physicians. So that's a big value of pharmacy that, quite frankly, has been underutilized in the past. Right. And again, I think a lot of that underutilization is systematic. It's again, it's regulatory barriers, and certainly barriers to reimbursement and getting paid fairly for those services. But a lot of people, including us, are supporting a lot of change there. And again, I see a bright future for community pharmacy. And there is a lot of value there. And as the J.D. Power rankings suggest, the consumers see it. They see that value. They feel that value every day. And it's just a matter of connecting the dots and again, removing some of those barriers to care so that those pharmacists can meet those needs and provide that value that they're prepared to do.
Yeah, absolutely. Thank you so much for taking the time to speak with me today, Brian. Now let's hear from some of our other MJH Life Sciences brands on their latest headlines.
What great insight, thanks to Pharmacy Times. Enclave is up next. Take it away.